I tried to help, and then the Friday said there's official IT stuff arrived. Yeah, I didn't do anything. Yeah, I wasn't doing that.
Yeah, thank you.
Yeah, that'll work. Yeah, yep. Yeah.
Yeah, it should be.
Yeah.
I think this is back on my session. Oh.
Thank you very much.
Okay, because the program said that you want to start.
No, don't worry, that's not it.
Okay.
Take it then. He's
Okay.
such a guy. Yeah, he's not. You're all set?
Yeah.
I think so, great.
Thank you very much.
So you can. I will come and before your budget.
Okay, just an hour.
Just on
Joke, joke. Wait.
Yeah, exactly. Well, we're out of breath. Yeah. Right. Probably about that. It is time. Pull the body.
Yeah. Thank you very much.
So colleagues, I think we can start now. And I hope other colleagues will join us sooner. So good morning, everyone. Welcome to this session on washing schools. I also want to welcome our colleagues who are online. Can you hear me well? My name is Irene. I work for UNICEF. I'm the focal person for washing institutions based in New York HQ. So this session is in two parts. So we'll hear from our colleagues from the JMP on the latest data on washing schools, but also some interesting perspectives about the analysis, the progress we are making, and the different data sets from different countries. Thank you, Rick. And then we'll hear from UNICEF on the framework for accelerating washing schools, which I will present. And then we'll have a colleague, Daniel, from UNICEF Ethiopia country office, who will help us on a group exercise just to pick your brains, but also to pick your insights in terms of what you would want to see in terms of accelerating washing schools, but also, what some of the approaches that you're using to implement washing schools in your country or in your organizations. So I think we can get started now as I invite Rick.
Thanks, Irene. Good morning, everyone. Good morning to the online audience as well. We do have simultaneous translation to French and Spanish. So if you're listening online, make sure you can take advantage of those opportunities if you'd like. So as Irene mentioned, we'll start with a brief overview on the progress on washing schools from the side of the JMP. I'm Rick Johnston. I lead the WHO side of the Joint Monitoring Program. And last year in 2022, the JMP published its progress report on Washington schools. And we're moving towards what we call shorter reports, data updates, or full reports. And last year it was a shorter data update for Washington schools, which meant that we didn't go into the full detail that we do in a full scale report, but we also had two thematic pullout sections in this one. And those were about pandemic preparedness for reopening schools safely and disability inclusive wash services in schools. So I'll just very briefly touch on those things. But I'll spend more time talking about the basic headlines. We have basic wash services indicators for Washington schools. So what proportion of schools were meeting those in 2021? What's the progress look like in terms of achieving targets of 100% coverage by 2030? And also, what can we say about inequalities and even going beyond those very basic wash services in schools? So to remind people, we have, of course, goal 6, which talks about universal and equitable access to wash services for all, which implies not only households, but different settings, including schools. But then under goal 4, the education goal, there's a specific target around facilities that having basic services, which include basic drinking water, sanitation, and hand washing facilities using the wash indicator definitions. So then we can reference these ladders that we have as for households and healthcare facilities. The ladders for schools are simpler than the ladders for households. We don't have a safely managed services level in schools, at least not yet. Part of that's just because of the limitations of the data. Part of it's because when we started monitoring schools in the SDG period, there was no baseline at all. So it makes sense to kind of start with the basics and then work your way up to higher levels of service, more nuanced monitoring. So if we look at a basic drinking water service, it is very basic. It's about schools having drinking water from an improved source, which actually has water available at the school. It doesn't need to be, the source doesn't need to be located on the premises of the school, but water needs to be available within the school to meet the basic service level. Then if there is a water source, but water is not always available, or it's not available when the assessment is made, that counts as a limited service. And of course, if there's no water source, no service. The sanitation basic service level is a little bit more complicated. It's about having improved sanitation facilities that are single sex and usable. Usable is a tricky definition because what some people would classify as usable, others might say, I'm not using that. So we try to clarify that, well, to be usable, a toilet or a latrine, I mean, it needs to be available and accessible to students. It can't just be locked all the time. It needs to be functional, and it needs to provide at least a little bit of privacy. And that means at least having some kind of doors that actually close, that don't have big gaps or holes around them. But that whole usability one can be a little bit difficult to measure objectively. Then likewise, if you have some improved sanitation facilities, but they don't meet all those criterion for basic, it will count as a limited service to distinguish from those schools that just have no sanitation facilities or only unimproved facilities like unimproved pit latrines. Then the third ladder, hygiene, a basic hygiene service is defined as having hand washing facilities at the school with water and soap available. And we find often that there are hand washing facilities, but they're lacking sometimes water, but very often lacking soap. So that would count as a limited service level. And again, no hand washing facilities, or if there's hand washing facilities, but there's no water, that would be classified as having no service at all. But as you'll see, these are very basic levels. I mean, there's not talk about sufficiency, quantities, actual utilization. That's not here. It's a very limited basic service level. But still, we struggle to get data to monitor even at this basic service level. So the JMP does collect and compile these data. We use similar methods to those that we use for households or healthcare facilities. I'll show you a little bit today how those data are combined and used to produce the estimates. But we update that global database every 2 years. And this was our third report of the SDG period on schools. And you can see just on the level of data progression, we've moved from having about 500, under 500 sources in our first report to over 1,000 sources. So we've doubled the number of national data sources that we've drawn on over these 3 cycles. It's important to note that we don't use any modeling or imputation that draws on information from other countries. We don't fill gaps by assuming things based on covariates like the situation in households or economic variables. We rely on national sources of data. The most substantial source of data we have comes from routine EMIS systems, that's shown in the dark black there. We actually have more coming from the UNESCO Institute of Statistics, which is a secondary source of data. It's basically a questionnaire that countries fill up, drawing on primary sources of data. If we have the primary source of data, we prefer to use that like an EMIS instead of UIS, because the UIS data are simplified and not as granular as the primary sources of data. Then sometimes we'll have an actual facility assessment, a survey or something, but there are very few of those compared to routine data reporting. We had an average of about 5 data sources per country in our last report. And if you want to see those data sources, you can go to our website where we have what we call country files, Excel files that that collect all the national data information that's available. They put it in an Excel form so you can see what data we collected and also what the resulting estimates that we produced are. So on our data portal, we have household, schools, and healthcare facilities. If you would go to the data portal for schools, there's that little button that says download data. Of course, you can make your own graphs and things, that's fun. But if you would download the data, you would get to this page where you can see the different countries. And I'm just going to show some examples of the Rwanda country file. Rwanda has relatively good data, so it's a nice example here. The Excel file has a lot of tabs here. Let's see. Oh, I even have a pointer. Look. So you could see the water data, the sanitation data, the hygiene data, the introduction tab. You can see the ladders. So you can see that at the national level, Rwanda has basic water, basic sanitation, basic hygiene, but it's lacking urban-rural estimates. A lot of countries' data systems don't disaggregate the information on schools into urban and rural, but they often do disaggregate into secondary schools, primary schools, and sometimes pre-primary schools, but that's another area where the data coverage is less. One of my favorite tabs in the country files is the data summary tab, because that lists all of the national sources of data that we've drawn upon and the different variables that we've extracted from them. So I picked Rwanda because we have over 20 national data sources, and they're a real mix. We have EMIS data, we have UIS data, which we classify as other, and we even have one survey here that was from World Vision in 2017. Now, we use all of those. It doesn't matter to us whether it's routine data or a survey. We extract, if data can be extracted for them, about these global variables. Improved sanitation, improved and usable, improved in single sex, or basic, meeting all of those for those different domains: national, urban, rural, pre-primary, primary, secondary. And you can see that some columns have a lot of data. So like improved in primary schools, improved in secondary schools, but some have very little data. So urban, we have nothing basically. And then some data sources like World Vision here, there are a lot of fields that we can get from it, but then other data sources, there's just 1 or 2 data points. So that's the national data sources that we collect. And then we simply put them in a linear regression. And sometimes there are a lot of data points, like for basic water at the national level, you can see a nice positive trend there. For others, like pre-primary sanitation, there's just 1 data point. So we can't make a slope or regression. We just take that 1 data point, and we have rules about how far forward or backwards we can use a data point. So actually this EMIS data point from 2017, we can use that for 4 more years. That'll get us to 2021, which was the reporting year for our 2022 report. But for our next report coming out next year, it'll be a 2024 report with statistics from 2023. And we can't use that old EMIS anymore. So we'll lose our data for pre-primary sanitation unless we have more recent data. So basically, we can never make an estimate on a data if the most recent data source is too old. In the case of a single point, if it's 4 years old, that's as far back as we can go. This is important because we're doing our country consultation soon for next year's report. And because of aging data, a lot of countries are going to lose the estimates that we had in our last report. Finally, you can look into the detailed extracts on the water data tab or the sanitation or hygiene data tab. This is showing that World Vision assessment where they had detailed information about the types of water supply, whether it was on premises or not. It was only conducted in rural areas, so we don't have urban or classification of schools. And then the EMIS had much fewer categories, and they're also a little bit hard to interpret sometimes. So they said that 60% of schools had improved drinking water, but 76% of schools had rainwater harvesting systems. And that doesn't make sense to us because for the JMP, rainwater is an improved drinking water source. So you can't have rainwater being higher than improved. So a lot of what we do in preparing the country files is try to interpret these and match them to the global categories, and it's not always easy to do. Okay, so those country files are the really important way that we share information about how we're calculating those estimates. And whenever we do a global update to the database, we share those country files. We share the drafts with the national authorities and give them a couple months to review, give feedback, and let us know these 3 key questions. 1, are we missing something? You know, is there a national source of data that we don't have in the file that we should use? 2, are the data sources we have used reliable? Sometimes we put in a data source and the country says, you know, that wasn't representative, or there were some quality problems with that survey, or that year something went wrong. Don't use that. And then the 3rd could be this interpretation classification. Like that rainwater harvesting example, we could interpret that a couple different ways. Some of them would be wrong, and we would hope that the national authorities would identify that and tell us, no, you're interpreting those data wrong, don't do it that way. And then we could fix it before we finalize the data. And we have this cycle where we send out the draft estimates towards the end of a year to allow a couple months of feedback and consultation before we finalize and produce the report in June or July of the following year. Okay, so coming back to the 2022 report, this is another data coverage table, which shows that same message that for urban, rural, and pre-primary, we have much less data coverage, shown in yellow, whereas at the national level and for primary and secondary schools, we're reasonably good in terms of data coverage at the global level. But in some regions, like particularly Latin America and the Caribbean, we just don't have that much data. So if we don't have sufficient numbers of countries from a region, we can't make a regional estimate. And that's what happened for Latin America and the Caribbean. Okay, but at the global scale, we did have enough data in our last report to show that basic water, and again, that's just having water from an improved source that's available on premises. The source doesn't have to be on premises, just the water. We only saw a growth from 70% in 2015 to 71% in 2021, sorry. So not impressive progress, you could say. And that still left 546 million children going to schools that don't even have a basic drinking water service in 2021, including 288 million whose school had no water service at all. You can see the different regions. As I said, in Latin America and the Caribbean, we didn't have enough data to make an estimate. You can also see these groupings like fragile contexts. And actually, we found that about over half of the children who don't have basic drinking water service at their school live in countries that are called fragile contexts. And this is an OECD classification. About a third of school-age children that don't have basic drinking water lived in the least developed countries. 56% of schools there had basic water services. For sanitation, we had a little bit better data coverage from Latin America and the Caribbean, so we could make an estimate there. And we saw also at the global level a little bit more progress, going from 65% to 72% in 2021. We had data from 123 countries, but that still means that 539 million children lacked basic sanitation service at their school, including, if I can see my notes here, mouse, no. Sorry, I should have it all memorized. Including that 13% of the population, that's 240 million school children whose school has no sanitation service. So what does that mean? No toilets or only unimproved toilets at the school where 240 million children go to school. I want to pause on sanitation to give a little advertisement to a call for papers on monitoring sanitation and wastewater in the context of SDGs 6.2 and 6.3. This is a collaboration between the Joint Monitoring Program, UN Habitat, which monitors wastewater, and the journal NPJ Clean Water. It's an open access journal. It's got a really good impact factor. And we are asking for any papers that have to do with monitoring. Could be in schools, doesn't have to be in schools, but anything about monitoring sanitation and wastewater for the SDGs. Please go to the website to learn more about that. The deadline's the beginning of February. Okay, sorry for that plug. Back to the report, basic hygiene services in school. Again, we're seeing some progress at the global scale with coverage increasing. Coverage is lower, but the rate of progress is a little bit better, going from 52% to 58%. Still lacking data from Latin America and the Caribbean in this one. But maybe there's some more hopeful signs of progress, you know, going up 6 percentage points in fragile contexts, 8 percentage points in least developed countries. But frankly, when your baseline coverage is so low like that, it's easier in some ways to make more rapid progress. And I would say that the hygiene service is one that's easier to make progress on as well. This is just about having basic hand washing facilities at schools that have water and soap. And we see that there's a lot of schools that have hand washing facilities, but don't have water and soap, especially in sub-Saharan Africa. It's easier to make sure that those schools actually have soap and actually have water than it would be, say, for a school that doesn't have water supplies to make sure that the school has water. You know, it's more, it's not software, but it's lower cost consumables, say, than high cost infrastructure. Okay, but looking at all three of those service areas and the rates of progress, we could project forward to 2030 and see where that historical rate of progress would get us by 2030. And in no case does it get us to 100% coverage. For water, it would only get us to 73, and the rate of progress would need to be 14 times higher to reach the SDG aspiration of universal access to just basic services in schools. For sanitation, the rate of progress would need to be 3 times as high, and for hygiene, it would need to be 5 times as high. Even for schools that are classified as having no service, eliminating no services, double negative, is not even on track, except for the case of sanitation. So maybe the good news is that the world is on track to eliminate schools that have no sanitation service by 2030. It's not a real catchy slogan. Yeah, and it doesn't rise to the ambition of the SDGs. So, but you know, that's what we got. One thing we try to show in the reports is to highlight inequalities between different types of schools. Where we can disaggregate rural, urban, or type of school level, and generally find that services are better in urban than in rural areas. So maybe the gaps aren't as large as you might expect. Much bigger gaps sometimes between secondary and primary schools. This Bangladesh is an outlier here, where secondary schools were found to have much lower hygiene services than primary schools. Very often it's the other way around, as we see in Mongolia. Second plug for our website is if you would go to that data portal and not click on download data, but on create new chart, you would be able to navigate some of these figures dynamically and iteratively. We have 3 kinds, interactively, not iteratively. We have 3 kinds of charts: ladders, ranks, and trends. Here's an example of a trend chart that recreates a little bit the trend chart that I just showed you, that the world's not on track for water, going from 70% to 71% for basic water, no services decreasing from 18% to 15%. And there's a little control panel on the left where you can toggle and say, well, I want to look at sanitation, or I want to look at population instead of percent coverage, or I'm interested in certain only the basic level, say. So you can customize. You can also save and create a dashboard that you could share with people. I quite like rank charts because they compare one country to another, or you can compare one region to another. And you can see, for instance, that among low-income countries, Malawi had the highest level of basic water services in schools. Sometimes it's nice to see, especially within kind of peer countries, which countries have higher or lower service levels for the different indicators, or which countries lack data and plot as gray on the charts there. I started by saying that these basic service levels are very basic. We haven't defined a global advanced or safely managed level for wash services in schools. Partly that's because of lack of data. Partly it's because there's not a global consensus of what exactly that would be. We could borrow concepts of safely managed from households, but they don't always translate directly into school or healthcare facility settings. So at this stage, we're just recognizing that countries, especially countries that are already close to universal basic, they may well be targeting higher levels of service. They might be looking at drinking water quality or quantity, menstrual hygiene facilities in schools, ratios, sufficiency, not just is there at least a toilet, but are there enough toilets to meet the needs of all the students that are in schools? And for hygiene, not just are there hand washing facilities with water and soap, but are they actually used? Are students washing their hands? Are there group hand washing facilities? There's a lot of different higher level type indicators that schools and countries are collecting. We try to highlight those in our reports as good examples of things that go beyond the basic service levels. So I mentioned that we've focused on disability inclusive wash services in schools. Shocking to see the gap between countries that have at least some kind of toilet and then a disability accessible toilet in schools. I mean, the worst, is Peru, where 100% of schools here had some kind of toilet, basic service level. 5% had toilets that are accessible to students in wheelchairs. So it really highlights the gaps. There are some countries, that are doing better. Uganda, the gap is only 100% to 62%. And then another example of an indicator that goes beyond the basic is around solid waste management. We don't even have a ladder for that. We do for healthcare facilities. But in schools, we find that a lot of schools, the schools have to manage solid waste. Most often in the countries that had data here, that's done by burning it and not burning it in like a proper incinerator, but often just, in an open pit. So again, I said that on our website, you can download those country files, you can see the ladders, you can create your own maps. We have those in multiple languages, by the way, the country files. So with that, I want to wrap up and say that in order to increase management of data on wash in schools, we do have core questions that can be integrated into routine monitoring systems. We have examples of those advanced service levels or indicators that countries could include if they're so inclined. And we have tools to assist in the analysis of data, including disaggregation, and in reporting on data at different levels. So, of course, if you don't monitor it, you can't improve it. Doesn't mean if you monitor it, it necessarily gets improved, but at least it's a necessary, if not a sufficient condition. So some of those resources are available at our website. I thank you very much. And I'm going to pass over back to Irene for our next one. Oh, except to say that our next report is coming out next year, and we would like to have a thematic focus on menstrual health in schools. So if any of you out there, I'm looking at you, Splash, have data on menstrual health in schools, send them to us, and we'll see if we can incorporate them in that forthcoming report. Thanks very much. Back to you, Irene.
Thanks, Rick. I think we take a few minutes just to ask a few questions if you have any. Any questions to Rick? Rick, do you want to stay here or you can take your questions from there?
If there are questions?
Yeah. So
sure.
Go ahead. Yeah.
But let's actually use a mic for the online audience. Here you go.
Okay. Thank you, Rick. That was super interesting. My name is Genevieve. I'm with Lixil on the SATO team. At SATO, something we struggle with is when we think about toilets manufactured and toilets installed in school settings, understanding like how many students are reached. And then you share that number, I think is 240 million students without any like improved sanitation facility. How do you translate the data that you're getting into numbers of students? I'm just curious about what assumptions you have to make or how you draw that.
Well, it's a very crude way that we do it. We just take the school age population and we assume that the proportion of schools meeting a certain service level in the country is the same of the proportion of school age children in that country with that service level. So we don't do any weighting by the size of the school. We recognize that bigger schools probably have better services, but the indicators that we use are the proportion of schools, and we don't disaggregate within that by size of schools. So it's a crude measure. And it probably, I guess, would underestimate the quality of services because those bigger schools should have better services.
Hey, Rick, good job. My favorite part was when you said my favorite tab in the spreadsheet is, then you listed that. So I'm curious how the JMP factors in municipal water availability with school kind of water availability. And often the binding constraint in an urban setting is, does the city even provide water? And that's a different challenge to solve than does the school have water? And so I'm curious if you've like looked at those comparisons of city availability of water and the frequency of it and the school availability of water. Does that question make sense?
Oh, it does. And I wish that we had data that would allow us to explore that kind of granularity. Often we'll just get like one number, especially the UIS data. We just get one number at a national level, sometimes disaggregated into secondary and primary. And we don't know where that comes from, actually. With the MIS data, there is more scope to disaggregate, but usually, frankly, we just take the aggregate figures at the national or urban or rural or primary or secondary levels from MIS data. And the MIS data tends to be very thin in terms of details. So some of them are just like school has water, school does not have water. Some of them are much more nuanced and say, school has water from the public utility, school has its own borehole, school has, et cetera, et cetera. And where we do have that more kind of granular information, sometimes we'll highlight that in a box in our report, but we don't have enough countries with that kind of data that we can systematically aggregate it and make, group analysis.
Hi, thank you so much for the presentation. You had mentioned that you use national data to populate the reports and the sheets. I was just curious if you consider data coming from research studies on Washington schools.
Yeah, no, that's a great question. So our principle is about what data we can use. Our first, it has to be representative of a certain population. So in the case of schools, it would need to be either nationally representative or of primary schools or secondary schools or urban or rural populations. And we have some rough rules about sample size. So these are not very statistically robust. We have more rules of thumbs that if you want to make a measurement of conditions at a population level like that, you should have at least 50 schools in that domain that you're looking at. Except for the case of very small countries, this applies more for healthcare facilities, but sometimes a country doesn't have 50 hospitals, for instance, so you can't apply that rule. And then we look at the proportion of the total facilities. I think for schools, probably most schools have at least 50, most countries have 50 schools, so that wouldn't apply. So it needs to be representative. The second is that the data need to be mappable to the global indicators. And sometimes they're not. Like sometimes if it just says school has water, school does not have water, we can't do much with that. Especially on sanitation, sometimes they'll say have latrines. And then we don't know, well, are those improved? Should those count at the basic service level or not? But then the third one is it considered as an official statistic by the national authorities? So the ultimate arbiter of SDG reporting at the country level is the National Statistics Office. and they're always involved in the country consultation. So one of those questions was that we asked in the consultation was, are there any data sources that we're using which we shouldn't? And we've had examples where we find a research study, maybe published in a journal, and we say, okay, it meets the comparability and the representativeness requirements. We'll put it into the draft country file, share it in consultation. And sometimes the country will say, no, we weren't involved with that, or we don't have confidence in the quality that was done in that particular study. Please don't use it. And in other cases, especially if the government authorities have been involved in that research study, they're very happy to include it as an official source of data.
Thank you. Good morning. My name is Evelyn McKenna. I work for Washington State University. We work with partners to provide hard hygiene facilities in schools in informal settlement. One of the questions that we've been struggling with has been, when do we know that we're providing enough taps for hand washing for schools, because our schools have big populations. In some of the schools, when we joined to provide hand washing stations with our partners, the ratio was 1 to 279 children. When we provided a few hand washing stations, we got to 1 to 56 children. So what is the ratio for taps?
Yeah.
Has it been determined, or is that information available? We would want to provide this to our stakeholders, government, as we recommend provision of hand washing facilities, especially. Thank you.
Yeah, this question of sufficiency is a really difficult one. We find that countries do set standards for sufficiency for hand washing taps, also for toilets and stances. That's another one where we see many cases where schools have some facilities, but not in sufficient number. But there's not a global standard that's widely applied. And even if there was a global recommendation, we would still defer to national recommendations, because it's the country that sets the norms for their particular context. So the other challenge we face is that often we don't have data that would allow computation of ratios of pupils to hand washing stations or to toilet stances. So we tend to not include those in our data systems, but to highlight them as good examples in our reports. I think in our 2020, maybe it was the 2020 report, we had some data on school toilet ratios. And sometimes the ratios are different for boys and girls, by the way. And we listed the national ratio target and also the national actual ratios. And of course, the actual ratios were much above the national targets. But even those national targets, they varied a lot. So I think it's just not possible to say at a global scale, there should always be, one hand washing tap for every 25 students or something like that, because the local context really has to determine that ratio. So I'm sorry, we don't have a global standard, but we will highlight national standards when we find them, so that other countries could also say, oh, look, my neighbor has a standard of 30 or 50. Maybe I should consider something in that neighborhood. There are global resources, like there's a document called Essential Environmental Health Standards in Schools in low and middle income settings. And I can look into that and see if there's a recommended ratio for hand washing taps. I don't know off the top of my head. Okay.
Any other question?
Thank you very much. My name is Barbara from KNUST, Ghana. So I'd want to know, after collecting all these data, JMP, and then is there a way beyond the data, what happens? Do you do some sort of engagement with the national government and then find ways of bridging the gap because there needs to be an action behind these data. So how do you go about that? So that's not just the numbers, but what are some of the actionable steps you take to make sure these gaps are bridged? That's my concern. Thank you very much.
Yeah, data to action. The data are no good if they don't get used, right? I actually think that might be a good segue to the next topic because UNICEF is going to be presenting the framework for acceleration on Washington schools, and data is one of the pillars to inform programming and planning. But certainly the idea is that those programs and plans should be informed by realistic assessments of data. We do see that countries often set unrealistic targets. We're going to achieve 100%, by not even 2030, by 2025, without any consideration of the actual status or the historical rate of progress. But I will say about rates of progress, it's possible to achieve rapid progress in schools, more so than in households, because governments control schools and they don't control households. So we have examples of extremely rapid acceleration for WASH services in schools when a government takes it seriously and sets targets and devotes resources to it. Rapid change is possible, but that's more effective if it's informed by data and understanding of what the current situation and the current bottlenecks are. So maybe I'll ask Irene to flag those data to action points in the coming discussion as well.
Yeah. Okay. Okay, another hand up there.
So yeah, one other question. Do you have like data that now show that if there is hand washing facilities in schools and there are like improved water facilities in schools and children are spending so much time in schools, like, do you see a health correlation there? Like improved health or reduction in diarrhea or stunting? Because that's the whole idea why we're looking at this data, right? Is to improve health.
Yeah. I apologize, but I can't answer that question. I don't have the latest literature at my fingertips. I think there are people at this conference who might know more about that. Matt Freeman at Emory, though I think he's left today. I don't know if anyone else in the room has their finger on health outcome from school data.
There's an analysis of hand hygiene curricula at schools, and it showed a 17% reduction in the self-reported respiratory illness. And that was a meta-analysis of a lot of studies. That's the most recent kind of amalgamation of Washington schools related hygiene research, for example. But there are other things like that that have looked across contexts and across studies.
Okay, thank you.
Also, some of the like leading researchers from that out in the foyer a little bit.
Yeah.
Okay, cool.
Yeah.
Thank you.
Thanks. I would like to know too.
What?
I would like to know too. Okay,
Yeah,
great. Well,
thanks.
over to you then,
Yeah,
Irene.
So maybe just follow up on that question. Thanks so much, Vic. We have actually done some studies with Emory University in 2017-18 in Laos, where their findings were that actually the interventions on WASH in schools did reduce diarrhea incidents, and which also then led to improvement in attendance of schools. So definitely there's a correlation between improved WASH and good health outcomes. So I think that's a very good question. Okay, so we move into the next part of the presentation now. So this is the WASH in Schools Acceleration Framework. And like Rick said, I mean, this is our response as UNICEF and the WASH in Schools partners to the JMP data that we are seeing. So we want to make sure that we can address some of those issues in terms of the data gaps, but also the programming that our colleague from Ghana asked. So first of all, I want to recognize our colleagues on the WASH in Schools Network who provided inputs to this draft acceleration framework, but also our UNICEF colleagues And like I said in the beginning, presenting this draft framework because we want to provide you with overview, but also we want to hear back from you. What do you think you would want to see included in the framework? And this is where I'll invite Daniel, my colleague, later on to put us into group work. So, yeah, so the purpose of the framework, basically, it's really, this is a systems level, framework, and it's aligned to the SDG 6 global framework, and it has, 5 key priorities in terms of governance, financing, data and information, capacity development, and innovation. And this is what we call the accelerators, for Washington Schools framework. And why the framework now? There are 4 key points. One is that we need to accelerate. I think Rick did mention in his presentation that we need to accelerate. I don't know if any one of you remembers by how much we need to accelerate water alone. It was quite a high rate, 14. Yeah, excellent. And then a 3% on sanitation and hygiene was, 5, excellent. So we need to accelerate. This is why we are developing this framework, because we need to meet the targets by 2030. And then the second one is really to provide, support, technical support to our governments, to partners, to make progress in this area, as well as to stimulate partnerships, galvanize collaboration between, the different partners. And it's also, a basis for us to make sure that our programming is coherent. Like we said, we are doing so many things in different countries, but we want to make sure that all our results contribute to the vision, our SDG Agenda 2030. So the target audience for this framework is really everyone involved in Washington Schools, from Ministry of Education to different ministries that we work with, Ministry of Water, Energy, and others, as well as NGOs, UN, climate actors, as well as our donors and the academia, as well as the private sector also. So these are the people working with, not forgetting the communities. We've been hearing about the communities a lot, civil society. Those are part of the audience. We just need to include everyone here. So these are some of the key messages from the framework. Really, it's a call to governments and partners to prioritize, some of the things around the 5 accelerators that I talked about. So all of these key messages relate to the 5 accelerators on governance, financing, data, capacity building, and innovation. So the first one is really about clarifying accountability. So I think most of us know over the years, we've been talking about these things and really asking who is really responsible for Washington Schools? Is it only the Ministry of Education? Do they lead? Are there other partners? Is it the Ministry of Water? So in different countries, this might be, the initiative on Washington Schools might be led by Ministry of Education, but also, drawing closely other ministries like Ministry of Water, but this needs to be clarified within the country level. And then the second one is increasing financial investments, because we recognize this is a challenge in most of the countries. Washington Schools sometimes doesn't get the attention that other areas within the education system receives. So for instance, education is mostly concerned about making sure that there's chalk for, teaching, the learning materials, the teachers have salaries, and water may not be so much a priority in some of the schools. So we want to make sure that they increase investments to ensure that all schools have basic wash services by 2030. And then in terms of monitoring, ensuring that the Washington Schools indicators, especially our JMP data, is included within the MEs, as well as developing capacity of those responsible for Washington Schools, and also innovative approaches. We are talking about more and more on climate resilience, and I think this is something that we want to make sure that within our Washington Schools programming that we can integrate elements of climate resilience. So some of the strategic shifts in terms of approaches here. So in UNICEF, we have strategic cycles. So the last UNICEF strategic plan was 2018-2021, and now we are moving to we are actually already in another strategic plan, which is 2020-2025. But of course, this is 2024-2030 is the period for the Washington Schools acceleration framework. So in the last strategy, we focused more on separate sanitation facilities for boys and girls. And then we're also doing a lot of global advocacy and focusing on development humanitarian mindset. But we want to shift a little bit. And we're not saying that we want to abandon some of the things we did in the last strategic plan, but we are saying that we want to do more in some of the areas. So for instance, we are now reporting a complete package of wash in schools. Rather than reporting sanitation alone, we want UNICEF as well as the whole sector that's working in washing schools to report a whole package on washing schools. A whole package meaning that we want, when partners are reporting or when UNICEF is reporting, we don't want to report on sanitation, but we want to report on water, sanitation, and hygiene, as well as waste management and environmental cleaning, because we recognize those are important elements of our washing schools programming. So again, on advocacy, we've done a lot of global advocacy. We'll continue to do that, but we also want to do national level advocacy. We want to put emphasis on national, because this is where the actors are, the governments are. We want to make sure that we can advocate with them to make sure that they can increase investments on washing schools. And then we have expanded our programming to look into peace building, the humanitarian development peace building nexus. So we want to make sure that in conflict settings or fragile countries that we can integrate peace building elements into our programming, as well as ensuring that we strengthen the capacities of the Ministry of Education to take leadership on washing schools programming, and also looking at the whole of society approach. So bringing everybody on board. It's everybody's responsibility. Education cannot do it alone. And then, of course, the systems approach on which this framework is based. So we want to make sure that we can support governments to strengthen systems. Rather than just providing water, we want to make sure that they have the capacities to sustain these services. And then, of course, integrated programming. Somebody talked, I don't remember who talked about integrated programming. So rather than standalone programs, we want to make sure that there are linkages with health, like our colleague there said, that our WASH programs improve health, but also we're working closely with the different sectors. Okay, so these are some of the programming principles. I will not go through all of them, but basically we are all familiar with programming principles. These are really things we want to make sure that we can integrate in our programming to make sure that the programs are complete, and to make sure that, there's ownership. And that's why we talk about involving communities and the civil society, but also doing advocacy and partnerships are very important. No single organization can do it alone. We need the partnerships. We need different people on board. I mean, we have different mandates, but also maybe different priorities within washing schools programming. And so we can't work in isolation. We need to bring our resources together, our skills and knowledge together to make sure that we can leverage, the sector efforts. And then, of course, gender responsive programming, as well as facilitating self-paced learning, making sure that countries can learn from other countries to see how they are managing these programs. And we had actually, I remember in 2019 or so, even recently we facilitated some of the countries to learn from similar countries, on what they are doing to improve their WASH programs. So this is the conceptual framework of how the washing schools acceleration framework looks like. So basically the vision, goal, the principles, as well as the accelerators, and what we need to do to implement it. So what are the vision again and the goal? We want to make sure that all school children have access to basic WASH, but also by 2030 as a goal, we want to have all schools with basic WASH services. So these are the accelerators. Like I said in the beginning, we have 5 accelerators on governance, financing, data, capacity building, and innovation. So this is the first on governance. So within these 5 accelerators, we have identified what we call core interventions or priorities. And maybe this is not all, and again, depends on your country context. So, but these are what we think that every partner should be looking at in terms of governance. We've always said, the government has the primary responsibility for all programs, and in our case, washing schools, and we want to make sure that we can reinforce this message to our governments and of course support them, to take leadership, but also making sure that we define accountabilities for washing schools sometimes it's not clear who's really leading. Education will say it's water who's leading, others will say it's education. But we know, of course, that washing school sits within the education sector, and we want them to lead, but with the support of other sectors like, the water, health, as well as infrastructure, Minister of Finance for funding. We need to talk with them because they are responsible for allocating funds. So we need to put a strong case before the Minister of Planning and Economic or Finance or Planning or Economic Development. I don't know what it is in different countries, but we have to put a strong argument with data that, we need to close the gaps on washing schools. If we don't do it, then, this might in fact impact our learning or the learning of students as well as their health outcomes. So, and then the coordination, very important. Now, we as partners, UNICEF and other partners, must make sure that, we support governments to lead coordination efforts at the country level, as well as, engaging everyone again, and, ensuring that washing schools is articulated in policies and national plans, and also ensuring, climate resilience with programming. So governance is really about so many things. I mean, as you can see, but yeah, maybe you have to prioritize to see what you can do at the country level. And then the second accelerator is on financing. As you can see, one of the things we want to support governments is to ensure that, there's financial or substantial financial investments to ensure that, the hard to reach areas or areas that don't have wash services can get these services, but also to ensure that we can support governments to optimize financing for WinS. So beyond just enough resources, we also want to make sure that we can support governments to ensure that they can use available and scarce resources more efficiently, so that it's not wasted. But also to make sure that we can identify other financing sources. Sometimes this can be within the countries. They can look at local revenue generation, but also, maybe some concessions within the country to ensure that they can fund some of the underfunded areas. And then we want to make sure that, we can support them to obtain funds or allocate funds for operations and maintenance of these services, because I think this is one of the key areas for washing schools. I think we've often had that sometimes we are providing these services, but they don't last. 1 year, they're broken down and there's no repair and maintenance. And so we want to make sure there's sufficient funding allocated during planning to operations and maintenance of these facilities for their sustainability. And then, of course, support the governments in terms of budget reviews and also fiscal space analysis, just to understand where do most of the funds go within the government. Sometimes other sectors get more than education. So is there a need to reallocate some of those fundings? I mean, the funding available to education sector, but also within the education sector, if there's more funding going to other areas, which might not even utilize all the funding, can we divert some of those funds to washing schools? So this is all what we want to see within the sector reviews and also fiscal space analysis. And I'm sure that most of us are involved in these processes. And if you're not, maybe try to seek from your countries when you go back to see that you can understand and maybe contribute to those efforts and advocate for washing schools. Yeah. So that kind of information, Rick took us through, a lot of status of washing schools. And as you heard from him, some of the countries don't even have data available for us to be able to estimate at the global level where we are. So I think this is one of the areas that we need to work with and support governments to ensure that, we can close the data gaps, but also that we can use the available data for planning to inform washing schools programs. So yeah, strengthen WinS indicators within EMIS, but also support conduct of national assessments. So if there are any surveys that are taking place, that we make sure that we can include washing schools questions within those surveys to collect information, but also ensuring that, we can support them in terms of analysis, validation, standardization of data, and the use of that data for planning, and then regularly monitor and review progress. So if there are any reviews within a country, looking at WASH as a whole, making sure that WASH in schools is part of that review. Sometimes reviews are taking place and nothing is mentioned on WASH in schools. I've seen those instances. So we want to make sure that as WASH in schools partners that we can advocate for a review of WASH in schools as well, you know, and that can only happen if it's already part of the plans on WASH, but also that we have included some questions, you know, in terms of the surveys that are conducted. And then the other one's really about developing WASH in school standards. I'm happy to hear from our colleague Evelyn in Kenya asking questions around standards. So I think it would be good to have, you know, national level standards on WASH in schools so that we can understand what are the requirements, how many students per. We have the ratios for students to classrooms, right? And ratios of students to teachers, but we have those for the hand hygiene or hand washing stations. We have for sanitation as well. We know in most countries it's like 1 latrine to 25 students or 50, depending on context. So we want to make sure that all countries have these standards to guide their, you know, interventions. And then capacity development, want to make sure that, you know, governments can commit some funds to build the capacity of its staff to manage WASH in schools programs, but also, you know, build institutions, capacities to Ministry of Education, basically to lead this effort, as well as, you know, making sure that we provide technical support to the governments to manage the WASH in schools programs, and that we can replicate some of the efforts or approaches from different contexts or different countries through, you know, South-South learning to the countries where we work. And then, you know, we can also, like I said earlier, promote, you know, propose this learning between countries, but also within the country, you know, between the different districts or regions. Okay, and then innovation here. So we want to make sure that we can support governments to obtain, you know, innovative technologies for WASH in schools. I think during COVID, we saw a lot of innovation, especially on hand washing. You know, I saw a lot of countries develop, you know, the pedal taps for hand washing or non-touch hand washing facilities. And I'm sure there were a lot many others also in terms of sanitation and maybe water. So we want to make sure that we can support governments and our partners to use those technologies and that they can be able to obtain them, you know, at minimum cost, but also making sure that we can support governments to identify and leverage, you know, alternative financing mechanism to improve budget allocations to WASH in schools, as well as, you know, model program approaches like the WASH and the 3-star approach for WASH in schools. This is an approach that we've been using as partners to progressively improve WASH services in schools. And so we want to make sure that we can promote those approaches, recognize that some of the countries don't have enough resources to move from no service level to a basic service level, but that we can support them to move a step at a time until they reach the national standards. But maybe we have other approaches that we're using in different countries and in our organizations that we want to share with the rest of the partners. And then promote, you know, tested sustainable behavioral change approaches. So hand washing is one of the key challenges we have in healthcare facilities, but also in schools and also in home. So we want to overcome this challenge. How do we make sure that people wash hands? I think in yesterday's session, we were talking about hand washing and we're saying that, you know, after COVID, people, you know, went back to their old ways. People got tired of washing hands. But why do people get tired of washing hands? It should be like eating. We don't get tired of eating. So what do we need to do to make sure that we now know the usefulness or the importance of hand washing, you know, and we should be washing our hands, especially during critical times, you know, before you eat, after using the toilet. Some people, even after opening a door like this, they wash their hands because they don't know how many people have touched that door. And so why is it difficult for some of us to wash hands? So we want to make sure that we can promote and innovate, you know, approaches to sustainable, you know, behavioral changes, especially hand washing. And if you have some of those approaches that have worked, We encourage you to share them. And then climate resilience, again, as part of our innovation, making sure that we can integrate climate resilience into washing schools programs. It's one of the things that we are looking at now. We are, as UNICEF, we have shifted all of our programs to climate resilience, making sure that whatever interventions we are doing are based on, the climate rationale. So we want to make sure that all of our partners and governments are tackling climate resilience, ensuring that governments are including climate resilience in their policies. I don't know how many of us have heard about the national adaptation plans. These are plans that governments have in place to address climate resilience, globally. So we want to make sure that those are reflected in plans, not only at the household level, but also in the school context. And then, of course, partnerships. We also want some innovative ideas in terms of partnerships. We need new partners, not the usual partners. We also need to bring on board the new partners. We are talking about the business communities. They have a role to play in terms of washing schools. They bring in new technologies. They also bring in new ideas. Some of them even provide expertise, even the communities, So, yeah. So implementing the framework, what do we need to do? So sometimes you're asking ourselves, so we have the framework, but how do we start? What's the starting point? Where do we start from? And so this is why I put a few points here. So one of them is really making sure that WinS is integrated into country planning processes. So I think those who work for the UN, they know that usually there are programming cycles, and that this is a very important stage, making sure that washing schools is within those UN planning processes with the government. It's a starting point, because if your plans are not within those planning documents, it becomes difficult to prioritize and even fund them. So, but also within government, making sure that washing schools is within the education investment plans, as well as other educational plans, because the starting point is really making sure that you have reflected, in your interventions or your programs within the national level education investment plans, and that they are funded within that plan. So, and then of course, developing costed strategies. I know that a lot of countries are already developing their national costed strategies for washing schools, but also other wash programs. And I think this is one of the things that we can do to support governments to make sure that washing schools is prioritized. And then, of course, program integration. We talked about the linkages between washing schools and health and other programs. And I think really very important for us to work with other sectors, because when we work together, we leverage our efforts. So making sure we're working with health, child protection, but also education colleagues to leverage washing schools program. And then, of course, deciding where you want to start from. I think Nick took us through the JMP service level, where we move from the basic service level, from the no service level to the advanced service level. So this is something I put together to kind of illustrate what that might mean. So as you can see, should have actually been missing this. Okay, so as you can see, the no service level is really, where we don't have the wash services. And most of the countries are between, I think, a lot of countries are between the no service level and a limited service level. And so if we want to achieve the SDGs within the next 5 or 6 years, which are left before 2030, we need to work hard to support governments to move all the schools that have no wash services, and those ones which have limited services to the basic service level, because this is our aspiration for the JMP, attainment. We want to move all these schools to basic service level. I'm sure most of us who work in some of the countries back home in Africa, especially in the less developed countries, we've seen schools that don't have a drop of water, who have no toilet at all. I don't know how many of you have seen those, but I have seen a lot of those. So we want to make sure that all those schools move to the basic service level. And where schools have limited services or basic service level, we can support them if they have the resources, to move all schools to the advanced service level. So this is just, what we can do, but maybe we can't move all of the schools to the advanced service level, but at least we should be aiming to reach the basic service level for all schools. So I also just wanted to show you how UNICEF is contributing to this research. So like I mentioned earlier, we have our 2018-2021 strategic framework, which ended in 2021. And I just wanted to show you some of the results we achieved. So you can see the progress between 2018 and 2021, how many schools we reached with basics wash success. So within the 4 years, we actually surpassed our target of 20,000. We have planned to reach 20,000 schools. I mean, we have planned to reach schools with 20,000 schools with basic service with basic wash, but we reached 21,000. So we surpassed the target. And then within 2020-21, we started to track also the number of schools we reached with basic wash services through indirect support, which is really working with partners in terms of advocacy, improving monitoring. And again, we surpassed our target of 40,000 schools. We reached 8,000 schools through advocacy support, technical support to the governments and partners to improve wash services in schools. So this is really, I think, this was some good progress. So we need to continue working together to reach the remaining schools with basic wash. So this is our new strategy, which is really 2022-2025. And these are the targets for the 4 years. So we want to reach all schools with basic wash services. So 2022, our target was 4,500, but we reached 6,500. So again, we surpassed our target. And so this year, we want to reach 12,000 schools, and then 21,000 and 30,000 as the cumulative total by 2025. So in terms of emergency wash, we reached 30,000 schools in 59 countries. So I just wanted to show you this snapshot in terms of what UNICEF is doing, but also with partners in terms of system strengthening, which is this one here of indirect support, how many schools we are reaching annually. So what next? What do we do? So what do we do when we finalize the framework? So we hope to finalize the framework by November and then launch it again around November. December, we'll have a few webinars where we'll share it with partners and then disseminate it December, January onwards, but also then implement it from January onwards. And maybe around 2026, we'll have a midterm evaluation to see how we are progressing. And all through, we'll be doing monitoring, review, knowledge exchange, and documentation, as well as reporting. So this will go throughout the cycle of the framework. So now we will go into group work, and I want to hand over to Daniel to take us through this. Just to, like I said, we want to hear back from you. What are your views in terms of this framework? Daniel, over to you.
Good morning. I'm Daniel Galam from UNICEF Ethiopia, based in Addis. Let the Almighty God help us with the remaining of 6 years to achieve SDG. But with the current global crisis, unless the divine interventions, most of countries, I don't think. Anyway, let's hope. So in the interest of time, I'll take you direct to the group. I don't want to go through group 1, group 2, group 3, just read it. So let group 1, group 2, and group 3. We've got to have only 15 minutes. So 10 minutes for discussions and 5 minutes, for presentations. So group 1, group 2, group 3.
So group 1, 2, 3. So group 1 takes question 1, group 2, question 2, and then group 3, question 3. So if you can respond to those questions.
No, what are we supposed to do? Thank you.
Yeah.
The challenges I have one, which actually I want to ask, and it's about mental health and link of mental health to this emotion specific behavior. A couple of studies now, quite some good research showing that there is a clear link between the basically like the emotional behavior of children in specifically in fragile or conflict affected areas and the mental health. So, and this is something which I haven't seen mentioned this anywhere. So for me, it's a question like how far is relevant, if the WinS is going to take this topic also up, just based on research which is there, since the humanitarian conflict affected areas are mentioned. This is like one of the questions. Second one, I mean, the question which you raised, right, about the link with the house and its impact as interventions. I think this is also important. Like interventions, which is like topics has been discussed since many years, but it's still not answered.
No.
How do we understand? How do we measure house impact interventions? Like, for example, for water supply, maybe focus on basic access to basic water services, water quality is included.
Exactly.
So, and
That's my biggest concern, because now if you focus on toilets and hand washing and the kids are thirsty and they drink the dirty water, those two efforts are just going literally down the drain. Because most probably that water is contaminated. So yeah, that system is not really like a closed loop. So I think access to safe drinking water should be.
I think I prioritize drink inequality more on the agenda. I think that's something very important. We're really experiencing now. We have like multiple studies in Nigeria and Palestine and Russian schools, and we really try to relate the house impact and really bring up the water quality agenda. But there's a lot of resistance from government because it's not a basic indicator, so it doesn't move. If you provide the water quality, it doesn't move your school up the ladder. Right, so in the end, like it's not being prioritized, and this is for us like a big problem because we do see a very strong part here.
I'm taking notes. I have to leave promptly when this session ends at 10 o'clock. So if you plan on running late to report out something.
Unfortunately, I can't spell I have a meeting at 10, so maybe one of you.
I'll leave my notes behind though. And report out for the group.
Thank you. I can report. If I use your notes, then I'll be fine. Yeah, the water quality. I think on like this, what are the key priorities? Like there's governance and financing. I think the private sector can also play a big role here.
That's number 2.
Yeah, financing, but you know, there can be financing coming from different sources. There can be public financing and there can be financing from the private sector. And then there can also be like carbon credits, for instance, are also eligible for schools, which now becomes like a recurring revenue stream. It will not be, the schools will probably not be eligible for those carbon credits, but now the services that are provided to the schools can now leverage the carbon credits to ensure a continuous service towards the schools, because now having customers at the school now will generate those carbon credits. So that's what I thought on the financing.
And maybe back to question 1 about the things that are not in the framework, but I also think maybe the UNICEF framework is guided by the global
washing schools indicated. But I've been wondering, we have a component of environmental cleaning and healthcare facilities. But as an institution, but in schools, it's not there. So in schools, we have basic water access and hygiene, sanitation. But I don't have environmental cleaning in schools, which is in healthcare. I know it is not captured in the global indicators, but I thought maybe if either now or in future, school cleaning, environmental cleaning aspects needs to be addressed. The section mentioned something about that as well, in the presentation, and they consider that, so I think it's not like out of reach, but it's not the other indicators, yes. I agree totally, I think it's especially for toilets, the environmental cleaning is a big thing. And sometimes it's a choice between open defecation will be practiced or not, is if you can use the toilet. I don't know if it goes under the usable toilet definition, so if your toilet is improved but it's not usable, so it could be not being clean, being not usable. I don't know how this is related and how they do that, but it's general for all our complex facilities.
So I think the question is that for each accelerator, and that there are 5, we have to come up with 3 priorities for each.
You're good one, so it's just the first question.
Oh, it's only governance.
Yeah, it just, no, that's framework that address the current challenges. So what one only? Exactly. So what else?
Oh, okay. Oh, okay. You only have to do
Just
question
one.
one. Oh, okay. Oh, that's easy. Okay. 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 So you said mental health, water quality.
Yes, environmental cleaning. Environmental cleaning, this is what I've been up here. Yeah.
And what about waste management?
I mean, it's already mentioned, they already have, I don't know how well it is considered, so, but it is at least in the agenda.
Okay.
How far it is being done.
Because I know, for instance, if you promote now menstrual hygiene in schools, and now all these pets are going to pile up, how are those being, how are these being disposed, in an environmental friendly way? Maybe it's a bit of a luxurious, top of the ladder thing, but it's good to consider.
In general, the menstrual hygiene topic, I think it's also was mentioned. I think there's a lot of potential which can be done.
Yeah.
Still just direction also from both sides, from the education side, right? So especially if you go direction, hygiene behavior and behavior change, then including like not just focus on hand hygiene, but really including also menstrual hygiene. Menstrual hygiene is a part of that, and then mental health is something they huge added value. So I think we should profit more from the synergies between the different.
Yeah.
So I think it's
Behavioral change. I feel like a lot of these indicators are about like access. Like even if you have solar water, like are the kids gonna use that? And like someone mentioned like translating the data to actions, like if water.
You've got 3 minutes.
What else is there?
Yeah. Yeah. The question is like, how can this be like behavior change? How can this be transferred an indicator? It's so difficult to measure. Yeah. Like even if you do behavior change studies, it's difficult to measure. Like you have
Need to have a CCTV everywhere or something.
frequent observation assessment.
Maybe that's something like UNICEF push because they have like connections with local partners and other organizations. So like, how do we like, we have the data from DMP, so that's something maybe UNICEF can push like more into the action. Yes.
Thank you so much.
You work on the CDC funded project, right?
Sorry?
You work on the CDC funded.
Yeah.
project.
Okay. Yeah. The one in Kenya.
Okay. I'm with Baylor, so police.
We
and also
met
our-
yesterday
yes.
in another section. Yeah, and I've also done some work in Sophia. Skills in Kenya.
Oh,
Yes.
are you also working on drinking water?
The same program, I did some water quality testing for schools from hand washing stations.
And what was the outcome?
The outcome is low chlorination, high total forms, and some E. coli.
Is that data available?
Yes, there's a presentation
where-
today at.
Oh, okay.
And I think there's a poster that, is it you?
Yes, I
And
presented.
there's a poster that she presented from.
We're getting ready for publication, so.
Yeah.
Today at 4?
I'm not sure
Should
if
be
be
this topic as
done.
well on water quality of hand washing, because
Oh,
there are
okay.
a couple of studies.
You are
that
having it?
show-
No, Evelyn.
There are a couple of studies that show that like water quality for hand washing doesn't actually matter so much if the general hygiene conditions allow. So even if you wash your hands with the wet quality water, but with the soap, you still have a positive health impact of that. So it's better to wash hands with soap, with bad quality water, than you don't wash hands at all. Because like it's not like sometimes it's the option between washing the hands with bad quality or not, so you don't have the option. Yeah, washing with good quality.
The more
So, yeah, but then of course, if you have like very good hygiene environment and then you have contamination, then yes, it has a negative. Yeah.
The motivation behind this quality testing was because in the schools that this project was running, that was the only water that was available for drinking.
Okay.
So the
So
kids were
that's,
drinking from hand washing.
Ah,
We also
Yes.
do the same project
Yeah.
and like they're classified as
program
hand
for water
washing.
in schools,
Yeah.
with my water filters.
Yeah, they're classified as hand washing, but any kid could go up and fill the water and drink it. Because we asked the principals like, is there a drinking water source? And they were like, right there.
We need to wrap up. Time is over.
You're sending me something.
Okay, one more minute.
Thank you. Monday, I was in the session, yeah.
And you also from- I Sophia, I'm the person who works on. Oh, okay, yeah, we do actually complete the same program.
Oh, really? Okay. Ah, great.
Oh, and your webinars.
Really?
Listen.
Oh, really? Oh, can I write down your name? We have a card. Okay, can I get your picture of your name there? Or is this your email address?
No.
Oh.
A lot in sub-Saharan Africa, also Latin America.
Yeah, I'm forwarding it to myself.
Okay. Yeah, but when you have,
So type it here, please.
School housing facilities, in schools in Palestine, in, Nigeria, but in courses. Okay. So, yeah, sometimes, yeah, mental health. So, yeah, and, we try really to kind of study their health impact and also bring the water quality in the discussion. So, which is really something that's struggling with. So,
Okay.
Yeah, it's,
Yes, please.
it's,
Yeah.
like, we don't have a certain number.
Are you from Kenya?
Yes.
Oh, whereabouts?
Nairobi.
Oh,
So,
yeah.
it's a project, special
Okay. Wow. Let me give you my business card.
Possibilities is there, how can you?
This is from the Westlands.
Yeah.
May I call upon group one presenters? Group one presenters. May I call upon group one presenters? Yeah, just. Yeah, now I mean, it's gonna be presented by group one's rapporteur.
So hello, everyone. My name is Lisa, and I'm the founder of Nazafa Water Filters, and I represent group number 1, which we try to answer if the framework addresses the WinS challenges, if not, what we would like to see included. And some people in our group suggested that might be good to include the link between WASH and mental health. If mental health is very low, it might affect WASH behavior, such as hand washing or using sanitation facilities at the premises. Then the other question is, what are the health impacts? So that was actually related to the question I asked. So what if we now have all these improved facilities at the school premises? Now, how does that affect the health of the students? And we also thought it would be good to prioritize the service quality, especially for drinking water, because if there's no drinking facilities at the school and kids wash their hands with very high contaminated water and there's no option for drinking, they might drink the contaminated water. So then the interventions for sanitation and hand washing might literally just go down the drain. So although it's not in the GMP scaling, we still think it would be very relevant to include it because, because of what I just said. Yeah. And then the possibility to have more finance from the private sector. For instance, private companies that contribute to improved wash services at the school can also generate carbon credits. And that can become like recurring revenue. It will not be recurring revenue for the school, but it will be an incentive for a private sector now to keep servicing the school with the wash interventions. So that can actually be a good additional financing source to upscale the wash services in the school. We also suggested to include environmental cleaning because it's included in healthcare facilities, but not in schools within the framework. And we think there's lots of unrealized potential to address menstrual hygiene practices. And also we are wondering if behavior change could be better represented. Because if you have all these facilities, but they're not being used, then also actually it's a bit of a, unrealized potential. Yeah, so that were our thoughts in group 1. Thank you very much. Over to the next group.
Thank you very much. Thank you, group 1. Okay, group 2.
Our group ended up just going around and sharing about where we were working and what we were doing. So I'm going to try and combine these. I would say for us, there was a combination of governance and capacity building in terms of having dedicated leadership being needed and being able to coordinate. And in terms of similar line with governance, but also in terms of capacity building with decentralization happening in some governments and schools and district levels being authorized to spend budgets for those authorities or principals to be able to prioritize money towards Washington schools. Financing was mentioned several times, and then also innovation for needing to find what works locally in each context. Did I miss anything out of ours? All right. Yeah.
Thank you. Thank you very much, group 2, group 3.
Hello, I'm Megan with Splash. So for us, we talked about Splash does citywide Washington schools interventions, but collectively we talked about co-investment with government as being a key part and setting benchmarks for the government to contribute. And if they are not meeting that benchmark, actually pulling out. Having 100% models, whether that be in a city or in a district or a region. I think the education system in particular is built in a way that has coordination across areas. And so having full coverage of those areas is important. Ensuring accountability, I think it was talked about earlier, but we think the education ministry really does need to kind of take this under their wing. And then we talked about ensuring that menstrual health is included in basic, adding data into that, and having bilaterals require reporting within this and investing more in both menstrual health as well as WASH schools. We said we want to infiltrate the education sector and try and get WinS to be more of a priority for them. And then conducting independent assessments and having frameworks and almost leveraging that for competition across schools, across cities, across regions as a tool of motivation. Last thing was considering efficiency of our approaches and thinking about when it comes to scale, there might be this gold star approach to reach the basic level, but could we tier our interventions as well to think about how we can scale at a level that might require less funds or more funds to be able to achieve it?
Thank you very much, Group 3. Now I invite Erin to.
Yeah, so thank you so much. I think we've had some very good inputs from the room, and assuring you that we'll include your suggestions to the framework. As I said, we aim to complete it by November, and we'll share it with you via webinar, so keep your ears open. I encourage you to join those webinars. We'll make the announcement on Yama. It's a community practice that we always use to make announcements, but also share some key information publications. But also, if you're working in countries where UNICEF is present, you'll hear it from our UNICEF colleagues. Maybe they will invite you for those webinars. And again, also asking you to support us once the framework is ready, to disseminate it in your countries, in your organizations, to promote it. That way, you know, we get the uptake from the governments, from partners, all those involved in WASH schools, so that we can collectively, you know, prioritize these accelerators to strengthen capacities of governments to scale up WASH in schools. Again, thank you so much for coming, and we look forward to connecting with you again before we leave UNC, but also after UNC. So thank you so much, and thanks to my colleagues Rick and Daniel for support. Yeah.